going to be just demonstrating the flexibility of the spine and how the spine interacts with other muscular systems of the body. And if the spine doesn't move correctly, these other muscle systems will have to recruit from other areas of the body, which then causes strain or concern to the muscles. And primarily going to be talking about how the muscles of the low back become involved. We're going to show you now the simple aspect of how the spine needs to rotate. As I engage the infraspinatus and just hold that infraspinatus and concentrically contract it, what you'll notice is the spine starts to rotate. As soon as we stabilize there it goes. So just by engaging that infraspinatus, you can see that the rotation of the spine happens up here. Now if I want to change the spine to rotate down here, all I need to do is engage the supraspinatus muscle, and it'll create rotation on the lower part of the spine. Okay? So when I talk about the flexibility of the spine, that's the flexibility of the spine. So if we want to change it to the mid-thoracic, what we're going to do is we're going to go to the teres minor muscle, and we're going to actually engage that muscle. And you'll see, as soon as I engage that muscle, the rotation starts right here in the spine. So the spine has to be flexible and loose in order for the muscles that it needs to recruit to allow the movement to take place. Now, if we wanted to show you another example of this, in order to rotate from the middle part, what you're going to do is you're going to engage the medial aspect of the triceps muscle, and I'm going to concentrically contract that muscle. So once again, just by contracting that muscle, the rotation takes place in the spine. If we want to do it on the lower part of the spine, it would be the long head of the tricep, and that continues it. And then to do the upper part, we would do the lateral aspect of the tricep, and then we have a full rotation of the spine. Now to bring that back, all I would do is change the rotation, the direction of the muscle fibers in the arm, and that changes the movement of the spine. So when I'm talking about how it interacts, the spine has to interact and be able to move in order for movement to take place. That's what you want to be able to do, is you want to be able to loosen up these muscles here. Where it would engage in the lower back, if I engage the short head of the hamstring muscle, you'll notice that you can see how the lower back starts to extend, because what the body's trying to do is prepare itself to walk. All right, so if we want to shorten that, as we can essentially contract that, it brings the body back. That's what I'm talking about when we're looking at lower back problems. We have to look beyond the lower back, because as you can see, a lot of these muscles would have to move incorrectly to allow that pattern to follow. All right, in many cases, what people try to do is they try to move from the rib cage. So we're going to get Marge to rotate. I'm going to stabilize her spine so that it can't. But what I want you to watch is how the rib cage actually creates a turn. So if we can get you to turn to your left. The spine can't turn, but she's going to. And what Marge can tell you right now is, what is the rib cage doing?
I'm forcing it to move.
Okay. So what would be easier, to force it, and then when you force it, where do you feel the strain?
In the back.
In the lower back, right? Mm-hmm. So what we're doing is, that's where most low back strains come from, is the inability of the spine to be able to flexibly and easily move. We're going to show you a demonstration here on the gyrotonic machine that we use, and how that we correct it through our fundamental movement therapy.